Okay, well, I'll go ahead and get started, and I know we may have a few other people join as we go. But feel free, as we go. This is meant to be um, a discussion. If you'd like to, there's certainly opportunity for questions at the end. But feel free to chime in as well if you want, even though it's a virtual platform. But thank you so much for taking time out of your evening to join me tonight. So my name is Michele Derdzinski, and I am one of the clinical dietitians in the Cancer Center here. And I predominantly work with individuals with pancreas cancer. So tonight we're reviewing nutrition considerations surrounding pancreas cancer, which in all reality, anybody that goes through pancreas cancer often really knows firsthand many of the topics that I will be talking about. Perhaps not every single issue that can arise, but certainly common that someone with pancreas cancer experiences some. So I've been in this role for 3 years or so now since the pandemic. But prior to that, I was working at Freighted as well, but on the inpatient side. So I would work with people with all different medical issues, but the area that I took the most kinship to, if you will, was the pancreas cancer and just cancer in general areas. So I found my way into the outpatient setting. I work with patients while they're going through all stages of treatment. So whether it's chemotherapy, radiation, surgery, any combination of those, and then often in survivorship or the post-surgery phase as well. So we will touch on that. So the first slide here, just kind of going through an overview of what we'll touch on this evening. So first reviewing the role of nutrition with pancreatic cancer treatment, which is, as we probably know, is multifaceted. Understanding the major functions of the pancreas and how that can affect our nutrition. Talking through nutrition-related side effects that are associated with pancreas cancer and with treatment, and nutrition strategies to help support the correlating issue. And then finally, I just wanted to give a brief overview on current extra oncology nutrition related topics. There's a lot out there on the internet and in current research. And so I just wanted to create a brief opportunity to talk through or introduce some of those. And again, if you happen to have other topics outside of what we see here, my contact information is at the end, and I'm more than open to hearing from anybody to talk through things that you might see in the news or online. So first, just talking through, broadly speaking, the role of nutrition for somebody with pancreas cancer. So it is a diagnosis that comes with a relatively high risk for nutrition issues. Often that might start pre-diagnosis. For example, somebody might go to their primary care doctor and say, I'm having some general abdominal pain. I've lost 20 pounds. I don't know why. And then come to find out they end up having pancreas cancer. So that we would call unintended weight loss pre-diagnosis. The functions of the pancreas too certainly play a role. So our pancreas produces insulin, which is kind of its better known role. And that's important for nutrition, but also it makes pancreatic enzymes, and that's its lesser known role. But for someone with pancreatic cancer, it's super important because pancreatic enzymes are produced as we eat and released into the intestine to digest fat. And if someone is not making enough pancreatic enzymes, that can lead to a lack of digestion of fat, which can lead to GI issues, unintended weight loss, and poor nutrition status. Additionally, as somebody's going through pancreatic cancer, whether they're going through chemotherapy, radiation, or surgery, or a combination of all, there are different side effects from the different stages. So we'll talk through some of that at the upcoming slides. At Freighted, the dietitian services are fairly multifaceted, as they're meant to be for somebody with cancer and pancreatic cancer. So if you are somebody with cancer or a family member and you are not currently linked with a dietitian but would like to be, just know it's a completely free service and we are here to help you. So it's not something that's billed. It's something that we know good nutrition is associated with better outcomes, easier quality of life, greater muscle mass and strength to do all the things that you want to do. So ask your doctor about it. They can enter a referral and we will come to you. So what I mean by that is we would come to a upcoming doctor appointment and just stop by pre or post that doctor visit. It's not meant to take up a ton of extra time for you. You don't need to go somewhere at a different place and time for it. We also can call you over the phone if that's a better option for you. So just know we're here to help in any ways. So we started to talk about how the pancreas has a couple of roles that are impactful for our nutrition. So the first one that a lot of people experience is exocrine insufficiency, which correlates again with the absorption of fat. So again, our pancreas has that role of producing enzymes. So we eat, and our pancreas can signal or can sense that, and it releases these enzymes into our intestine. And then the enzymes work with the food through the gut to properly digest fat and create normal bowel movements. For someone whose pancreas is not making enough enzymes, they might have these bowel movements that are frequent or floating or tan in color, oily, and it might lead to weight loss as well. So if that is the case, which can happen at any point in the treatment course, the good thing is that there's a medication that can help. So you can see in the picture that capsule, which is a pancreas enzyme. So basically it contains enzymes that are derived from a pig right in that capsule. So in essence, you're mimicking the work of the pancreas yourself. The caveat is that we have to figure out how many capsules that you need in order to create normal bowel movements for you. So we start with kind of a small amount and then increase according until your bowels are normal. And then ultimately, if you got constipated, that's a sign that you are taking too many. So who needs enzymes? It can be anybody going through chemotherapy or radiation with the tumor. It can follow pancreas surgery. Sometimes people don't need it during chemo radiation, but they might need it after a surgery if they are a surgical candidate. Common brands are listed out here. So you might hear someone talking about Creon or Zenpep, which are the main ones. And then Pertzi and Pancreas are a little bit lesser known. It's really all just like Coke versus Pepsi, and it really is just dependent on your insurance coverage. They are all okay to take. However, Creon and Zenpep do have higher doses, which is nice because if you need kind of a higher dose of the enzymes, then you would have to take less capsules of that Creon or Zenpep. So I just listed some tips for success here. So if you are someone that's on enzymes, this might be a helpful slide. So basically we recommend that you say you're on 3 capsules of the enzymes with your meals. You would take a bite of food and then take the capsules ideally throughout the meal. You wouldn't take them all after the meal or way before the meal because they're not mimicking that role of the pancreas as well if you take them outside of the meal times. If you feel like the capsules are too big or you're still having gut issues despite taking a lot of capsules, what you can do is try to open that capsule, which I'll show you the picture here. This is a picture of an opened capsule with these granules. So what you would do is open those granules onto applesauce. It should be something like applesauce or pureed peaches, not something like ice cream or other foods, especially with fat, because that can start to actually, the enzymes can break down in something with fat since it's digesting fat. But if you do applesauce or pureed peaches, that can be helpful then to take the applesauce throughout the meal for 2 reasons. Then your body doesn't have to digest the capsule, but also applesauce contains pectin, which is something that helps to bulk the bowel movements in general. Typically, someone is taking an acid reducer medication like Pepsid when they're on enzymes as well. It helps the enzymes to work. If you are taking enzymes generally, we tell you to take 1 capsule or maybe more with snacks that contain fat. Uh, if you're somebody that just needs a real low dose of enzymes and are more on the constipated side, if anything, we might not tell you to take them with fat. That's okay. But generally speaking, if you have an apple for a snack, you generally could skip the enzyme. But say you pair that apple with peanut butter, we would want you to take the enzyme so that you can digest the fat properly. Theoretically, we'd rather you take the apple with peanut butter if you're going through treatment and trying to maintain muscle mass, losing weight, because that peanut butter would give you more calories and protein as well. So additionally, how many enzymes do you need? So this is really individualized for each patient. So it's based on bowel function. So if we have somebody that's coming in with multiple bowel movements a day, 5, 6 times a day, we'll start them on a higher dose and maybe a couple of capsules, having 1 or 2 bowel movements a day, but they're floating and oily and tan. We might start them on just 1 capsule with meals, and we could try a couple of different doses. So it's often 12,000 or 24,000 are the common doses that you'll hear. 12,000 is on the lower end, and 24 is kind of more standard. And it goes all the way up to 36 or 40 for someone that needs that higher dose. I mentioned earlier, if you are taking too many, that can lead to constipation, but just be aware if you're also on pain medications, that can also be a cause, obviously, of constipation. So just be mindful of all the different meds that you're taking and what's causing what. Sometimes it causes some abdominal cramping, and on really rare occasions worsens diarrhea. So just let us know if that seems to be happening to you. But for the most part, it would cause more constipation. So that's that pancreas enzyme function. So now the other main function of the pancreas would be blood sugar management. So that's what we would call the endocrine function. So our pancreas produces insulin when we're out in the world. We more so hear about insulin more than we would hear about the pancreatic enzymes. And that's because it helps to maintain blood sugar control, which is a big issue for a lot of people in the world, but definitely an issue for people with pancreas cancer. It might arise, the need for some kind of blood sugar agent might arise before diagnosis, or perhaps it doesn't arise till after surgery, if at all. But there's definitely a good number of people that need some kind of support, whether it's an oral agent or insulin, to help manage blood sugars. This is important to have your blood sugars in a normal range, because we know low blood sugar can make somebody not feel good. It could lead to issues like sweating and dizziness. And of course, we don't want that. And then long term, though, if somebody's blood sugars are not well managed, it could lead to longer term side effects like heart disease, kidney disease, and vision loss. So now just getting into more nutrition related challenges. So getting out of the roles of the pancreas and nutrition on the whole. With treatment, very often people report a loss of an appetite or perhaps feeling full quickly. Often losing weight without trying is extremely common. Taste changes and gastrointestinal issues. So that's usually things like nausea and diarrhea. Often this evolves with different phases of treatment. So for example, somebody might have taste changes or even something like a cold sensitivity with chemotherapy. And then maybe as they progress into radiation, they might develop diarrhea by nature of that radiation treatment itself. So we will get into each one of these as well. So loss of appetite and unintended weight loss. So if you are feeling like, oh, I just don't want to eat. I have no appetite. I have no hunger cues, and food is just not what it used to be. Just know it's really common, and you're not alone, and there's strategies that we can try to implement. So meal planning is a huge part of that. So trying to eat something every 2 to 3 hours that you're awake ends up being really important. And often, if you feel like food is really filling for you, then using protein shakes like Ensures and Boost can be helpful, especially outside of meal times. If you're drinking a lot of fluids at the meal times, you might just feel full from the fluids. So try to space it out as best that you can. Focusing on your high calorie, high protein foods. So that helps to maintain muscle mass, and after surgery, that would help you to heal. And those sources are meat, eggs, fish, dairy, nuts, nut butters. Another thing I didn't list on this slide is just simply leaving snacks around your residence. So if you're finding that you need a lot of rest, which is super common during treatment, and you maybe have a chair to watch TV in, and there's a little table, keep some snacks like maybe unopened protein shake there, granola bars, just some simple type of snack there. And then same thing on your kitchen table. If you can leave a banana and maybe like a jar of peanut butter next to it, something simple that you can grab. And maybe even like chocolate chips, if that sounds good to you. Something that cues your mind so that you're not constantly having to remind yourself to eat. The reason this is important is because stabilizing one's weight is associated more with improved survival, quality of life, and improved surgical outcomes. This is one area of nutrition and cancer research that is pretty well studied and documented. So stabilizing the weight as best that we can becomes really vital. So with that, our oral nutrition supplements are listed here. I just wanted to show a few examples too. So this is a really great list if for anybody that's currently in treatment. So basically, just want to see my camera here. These are different offerings. So one thing to really note is that we all probably know the brands Boost and Ensure, but what people tend to be less cognizant of is the variety of it. So Boost VHC, which stands for very high calorie, is really different than like a Boost Breeze or Boost Glucose Control. And they're appropriate for different types of people. So I'm showing the examples of Ensure in that sense. So this is the one called Ensure Complete. And then you can see it's 350 calories. So this would be really appropriate for somebody who's losing weight without trying and is tolerating these protein shakes, because it can help stabilize the weight faster than something like this, which is Ensure Max. There's nothing wrong with this one otherwise, but it just depends what someone's goals are. So this one you can see is 150 calories. It still has that 30 grams of protein. But this one would be more appropriate for someone who's on insulin and looking for a snack to take between your meals because it's low in carbs. So it has 6 grams of carbs. And for a snack for someone on insulin, ideally, we would have them do a 15-gram snack or less. So that's what this would be appropriate for. But for more broad weight stabilization, we like the Ensure Complete, or this Ensure Plus is nice too. So you can see this one is 350 calories. The difference between these two is the protein. So this one is kind of everything. It has 30 grams of protein, 350 calories, whereas this is 350 calories, 16 grams of protein. But for simplicity, whichever one is actually at your store so that someone's not running around all the stores is easier. The Ensures are pretty prevalent in store. Boost is pretty prevalent as well in the stores, but not their specialty products. So Boost very high calorie, or VHC, is 530 calories. So comparatively, it's even more than the highest versions of Ensure in terms of calories. So that one is sold online, or it is actually sold on the main Wauwatosa campus Cancer Center pharmacy. So it's a good option if you're here on campus and needing to really stabilize your weight, because when you think about it, 530 calories in one carton is the equivalent of doing an Entermax 3 times, or other kind of blood sugar control varieties. The Sprees, though, and the Enterclear that are listed here are really nice for somebody who's having a lot of nausea or who really doesn't like or tolerate the thick, creamy protein shakes. So those are nice alternatives. Someone could also put those in a blender with plain protein powder and like some kind of a slushy Italian ice, and that would make a nice slushy drink for you. And then finally, I brought 2 that are plant-based. So this one is Orgain. This one is easier to find in the stores. They sell it at places like Target and Fresh Time. So it's pea-based protein. They do have one now that's milk-based. So if you're looking for plant-based, look for the green. But the milk variety one is organic technically. And then this one's called Kate Farms. This one is only online. It's a bit more of a specialty product, but it's dairy-free, soy-free, gluten-free. And some people like the taste of this one more than the other varieties, but I've also had people that say the exact opposite. So just kind of mixing and matching and knowing that if you want to try a variety of these, the dietitians, if you're on site here, could give you different samples to try out before you would buy. The other benefit to this Kate Farms is that it has, I don't know if you can see that, but 455 calories. So that's really high for the volume. So those are the samples. Then a calorie listed here is really nice. It's been kind of a low inventory lately, but it looks like a little pudding cup and it has 300 calories and it's considered a food additive. It's not flavored. So you could add it to a protein shake or put it in pudding or something like that, just for an added calorie with very low volume. So eventually that's a great option once it's back in stock. Homemade recipes are really great too. We offer recipes if anybody wants them. Feel free to follow up through email or the phone with us. Making your own type of recipes is great too. You can then use things like ice cream and yogurt and frozen bananas with protein powders, or even using one of these in a blender with all that added to it. So the next topic would be taste changes. So this often we see with chemotherapy, but could also be from medications, zinc deficiency as well. Someone might be more at risk just to talk about zinc deficiency right away if they have a lot of diarrhea, because that could lead to losses of zinc. So if you're having these lingering taste changes, you've been having a lot of diarrhea, it could be worth asking your doctor to check your zinc lab and see if it is low, because that could be an easy way to help see if that was the cause of your taste changes. I will say though, if you don't just take a zinc supplement, because it can basically cause a selenium deficiency if you don't actually need the additional zinc. So talk to your doctor about that if needed. Tips for incorporating, tips for taste changes. First, incorporate mouth rinses. So this handout here, I can send to anybody if anyone would need something like this. The first thing is to rinse your mouth before you eat. It's a cup of water with a 1/4 teaspoon of salt and a 1/4 teaspoon of baking soda. Don't use the salt if your mouth is real dry though. What you do is just swish and then spit it out, and basically it cleanses the palate and gives a window of time where eating might be a little bit easier. The other tips, if you're having taste changes, are to use flavors that are very sharp. So things like vinegar, lemon, chili powder, and tart cherries. Try them out. What works for one might not work for all, but generally speaking, these are types of flavorings that are more enhanced for people with taste changes. Try to avoid anything that you know tastes bad. So if something is salty and historically you liked it, so you're trying to keep it in your diet, just let it go for the time being and use other foods instead. Because something that you used to not like might actually taste pretty good at this point if you're having taste changes. If you're having a metallic taste in your mouth, try to avoid metal utensils and use plastic instead, and then avoid aluminum cans. So canned beans, canned vegetables, that type of thing. The next side effect here is constipation. So it can be from an array of causes listed on the left. So correlating are the ways that you can try to help manage that. So for it can be caused by pain medication, chemotherapy, limiting your fiber in the diet, and pancreatic enzymes. Occasionally, what we see is that we tell somebody to limit fiber in their diet for a specific reason, and then they end up doing the diet for too long, or they end up constipated anyways. So always talk to the doctor if you're limiting your diet in any way and it seems like you've been limiting it for a while. See if you can start to liberalize that diet, because the more we can eat, the more normalized our bowel function will be, if it's appropriate for you. So with constipation, generally what we recommend is increasing those fiber-rich foods slowly. So those would be things like beans, nuts, seeds, raw fruits and vegetables, especially those that have skin and seeds on it. The skin and the seeds, like in a grape or a blueberry, is where that fiber is. Increasing your hydration, that's really important for bowel function in general. But especially for constipation, hot liquids tend to work well. So having some tea might help to promote the bowel movements, especially one called Smooth Move tea. So look for that by all the other teas if somebody else is constipated. It contains the senna plant in it, so it's just a nice natural way for constipation to try to be alleviated. Try to avoid binding foods if you can. Again, it's not to say you can never have these foods, but just notice if you have cheese and you're really bound up after that, make a note in your head that if you can try to limit the cheese, that would be worthwhile for you. Bananas, white rice, those can do the same, have the same effect. And then talk to your doctor, of course, about stool softeners or other laxatives as prescribed. A lot of people who are having constipation are on some type of a regimen that tends to evolve over time. A lot of things with the bowels and the medication and the diet are ongoing and evolving with time. So constantly having the conversations with your medical team is important. On the flip side, a lot of people with pancreas cancer at some point experience diarrhea. That can be caused by that exocrine insufficiency or malabsorption, and the support for that would be taking pancreatic enzymes. And then also there sometimes is a role for a low-fat diet. So right after a pancreas surgery, we would recommend somebody limit their fat, but just for a couple of weeks. And then the other time that's important or recommended is if somebody is taking a lot of pancreas enzymes, but still having those tan, floating, oily bowel movements, we might say try to limit the fat a little bit to see if that helps. But generally, we like to be as broad as possible with the diet and letting people eat as much as can. Other causes that are very common are diarrhea due to chemotherapy, radiation, surgery, or sometimes a temporary lactose intolerance. It can happen with treatment, and typically it is something that goes away over time. If you are having the symptom from any of the phases of treatment, we like people to limit their insoluble fiber. So that's what I was referencing on the last slide. So insoluble fiber would be things like nuts, seeds, and beans. Those promote bowel movements and help things to move along. Just to make it confusing, there's two types of fiber, and our soluble fiber would actually be helpful. Those help to bulk bowel movements, and that's going to be more like applesauce and bananas. And there's a list that we could give if anyone needed it. Additionally, limiting really sugary foods and sugar alcohols. This is sometimes not a culprit for people. So reading your body and noticing if you have like sugar-free candy or something like that, and then you're having diarrhea, it might be correlated with that. If you notice you have a glass of milk and then you have a stomach ache or something like that, it might be that you're having lactose intolerance, and you might be worth switching to lactose-free versions of food or limiting your dairy. And then same concept as constipation. If you're having diarrhea, sometimes people are on an anti-diarrheal medication regimen. So things like Imodium and Lomotil might be utilized. The soluble fiber note here about Metamucil and Benefiber, those are over-the-counter agents. So it's soluble fiber comes from food, but this is basically like an over-the-counter medication version of that. So what can you eat if you're having diarrhea? We said eat more soluble fiber-rich foods. I mentioned that on the last slide. And trying to eat more of those binding foods, cheese, rice, and bananas, which is just what I told someone with constipation to try to avoid. Make sure you're hydrating properly. So that's across the board, whether it's constipation or diarrhea. Water or oral rehydration solutions, which are either homemade or things like Gatorade, Pedialyte. And then sometimes probiotics have a place as well. Talk to your doctor. At some instances, it's not advised, but just can help to restore the gut flora, or the doctor maybe has a specific type of probiotic that they recommend that you take. So next topic here, pancreas surgery has lots of nutrition implications. So leading into surgery, which for pancreas cancer would be a Whipple, a distal pancreatectomy, or a total pancreatectomy. And that's referring to the different parts of the pancreas that could be removed, or for a total, of course, the whole thing, and then often the surrounding areas accordingly. Leading up to one of those, any of the surgeries, nutrition is really important to try to maximize, maintain the weight, maintain muscle mass, strength, activity, general wellness, and such. After surgery, it's to then restore and get you back to that adequate nutrition, maintaining weight, and then all along there, watching the bowel pattern, because of course that plays a part into our weight and our overall well-being and how we feel. So right after surgery, it's just important to note someone would be on a clear liquid diet, but then they would progress to what we call a low-fat, low-fiber diet. That's entirely a symptom management diet. It is not meant to be long-term. It's just limiting the foods that are high in fat and high in fiber for a couple of weeks while someone's healing, because we know those high-fat, high-fiber foods can basically exacerbate or worsen GI issues like bloating and diarrhea. Occasionally, patients might be on enteral or parenteral nutrition. Mostly at Freighter, we would use parenteral nutrition. What that is IV nutrition, essentially. Similar concept to IV fluids, but it contains calories and protein, fat, and carbs in it. And it's possibly used in somebody that's really struggling with maintaining their nutrition post-surgery for whatever reason, and needs that extra boost. And it's all to say that nutrition in that post-surgery period is really, really important to get in any route. And then hydration across the board. Sometimes the use of IV fluids is needed, but then increasing the intake of fluids by mouth in that post-op period as well. All along, the patients are being monitored for needs for insulin and or enzymes. So some, of course, were already on insulin and enzymes leading into surgery, and then some might need to start after. Just to briefly touch on some other current topics that are out there about cancer in general, and pancreas cancer. Vitamin and mineral supplementation is a hot topic with chemotherapy across the board for any cancers. And then it's a topic sometimes that comes up for the post-surgery period, and certainly other parts of treatment as well for pancreas cancer. Just to touch on chemotherapy, some people ask about taking high doses of something like a vitamin C or other antioxidants. Generally, that's advised against, but it is recommended that whatever supplement you're taking with chemotherapy and radiation, you talk to your doctor about. Basically, antioxidants are protective of all of our cells. So the theory is present that if you are taking a supplement that's trying to protect all your cells, but then at the same time you're getting a treatment that's trying to target and kill your cancer cells, that's kind of contradicting, and that's a conversation that we should have. After pancreas surgery, especially somebody that's having a lot of malabsorption, they may be needing to consider supplementation of fat-soluble vitamins. That's things like vitamin A and vitamin D. Vitamin D deficiency especially is very common with pancreas cancer. So basically, if we're losing some of the fat in our bowel movement, some of those fat-soluble vitamins may go with it because they go hand in hand with digestion. Another hot topic is the ketogenic diet. There's ongoing research, little bit more emerging in human studies, but predominantly has been studied in mice. But there are some human studies out there now, some in pancreas cancer, some in others, and it's primarily being studied during chemotherapy. And the thought is that a ketogenic diet is basically very low in carbohydrates and high in fat. And there's thoughts that taking in a very low amount of carbohydrates could help the chemotherapy to work, or help to limit the side effects after. In one of the issues that sometimes exists is people often follow ketogenic diet to lose weight. And so sometimes we see a lot of weight loss with someone who tries the ketogenic diet with treatment, and we don't want someone to lose weight, as we already talked about. So it's something that if you're considering or already doing, to talk to that doctor about that, and if it's appropriate for you or not. We have a booklet about the topic that we're more than happy to share so that you can make informed decisions. Same with intermittent fasting. There's theories that intermittent fasting at different windows, the window of time is not confirmed, and there's a lot of gray area there. But that intermittent fasting might help the chemotherapy to work, same topic, same concept, or help to limit the side effects of treatment. So we also have handouts and resources on that if somebody was looking for more information on the hot topics. We have recipe resources. So whatever stage you're at, there's different recipes accordingly. So if someone's in chemotherapy and having a lot of diarrhea, that would yield much different recipes than someone who's in the survivorship phase and kind of looking to follow a general healthy diet. So feel free to reach out. That survivorship phase is just something that I like to touch on too. So if you're somebody that's gone through pancreas cancer and perhaps you've had surgery and are looking to do what you can to prevent recurrence through nutrition, or just interested in the topic in general, we have booklets on that as well, and following a general healthful diet and seeing where you're at, and if you want to make certain tweaks to your diet if needed to. So feel free to reach out. My contact information is on the next slide, but just as summary, nutrition with pancreas cancer is really important just for overall quality of life and strength. We want to prevent weight loss unless that's something that your doctor has recommended, and then helping you manage your side effects through all the steps of treatment, because they can be multifaceted and they can evolve. So just monitoring and making adjustments to your medications or your diet accordingly. I could see what time it is. There's a few minutes if anybody had a question or two.
Feel free to unmute, or if you don't want to speak, you can drop it in the chat. It looks like there's a message in the chat. It says, how can family members or caregivers best support the nutritional needs of a loved one undergoing treatment for pancreatic cancer?
Yeah, that's a great question, because we are so involved with, or often with our family members' eating habits and such. So it kind of depends what their needs are, but if they have a really poor appetite, leaving snacks around their home that are available can be helpful, rather than constantly reminding them every hour, because sometimes that can create a little bit of tension, or it can just generally be annoying for a patient to be reminded all the time. But just leaving gentle reminders throughout But also helping the meal plan, maybe sitting down one day of the week and saying, what should we make for our meals, and having those meals available. And, if they are having a really bad day and just can't get that dinner down, it was available and it was planned, and talking about getting protein at every meal through that planning. And asking them, how would it be best if I support you? Because one person might really thrive on the meal planning and maybe help with groceries, while somebody else might not want as much.
Thanks for that. Any other questions? Okay, there's another one here. So what impact do you know of caffeine can have? What impact do you know of that caffeine can have? I'm 7.5 years since diagnosis, have half of my pancreas removed, and it came back in my lungs 2 years ago. I've tried figuring out what causes cramping at times, and I think it might be caffeine. And we moved to half caffeine coffee a while ago.
Yeah, caffeine can have the side effect of cramping. It really depends on how much coffee that someone is drinking. If someone is having cramping, I usually tell them to try to limit to a cup a day. With that said, coffee is a big part of a lot of people's lives. So if that's not feasible, then try to think about how fast you're drinking it, making sure you're hydrated otherwise, and then looking at the rest of your diet too. So bubbly drinks could cause cramping as well, gum because of the air that you're sucking in, drinking through a straw. And then a lot of those high fiber foods like beans, nuts, and seeds. So don't hesitate, or it could be medication related too. But if you are finding that it's bothersome, don't hesitate to ask to talk to somebody about it.
Thank you. Another question, weight gain and hunger post-treatment and surgery. Most can't seem, but I am the opposite.
Okay, sure. So somebody gets a pancreas surgery and then finds that they're actually gaining weight afterwards. Yeah, so that could be a good opportunity to well, first, how much weight gain, and is it getting you back to like your usual weight? But regrouping and seeing beyond the number on the scale, what kind of activity are you doing? Just kind of getting all those things in check. Are you eating good fruits and veggies? And are you eating things like beans and nuts that are good for health if your digestive tract can take it? But some post-surgery, some of that survivorship, the information could be really helpful.
Thank you.
Sometimes it's really multifactorial, so it can be hard to answer the questions in a couple sentences, because we really, all the dietitians that work in the office, usually like to get a pretty deep dive. So feel free to ask for more of a one-on-one if anybody needs it.
All right. Well, if there aren't any more questions, I think we'll go ahead and conclude for the night. Thank you so much, Michele.
Thank you. Thank you.
Yeah, thank you all for joining. Have a good evening.